Hello, good morning, good afternoon, good evening, everyone. Welcome po sa ating 123rd 123 episode of the Stop COVID Deaths webinar series brought to you by University of the Philippines. Thank you for being part of our credible online community, and to all those who have just discovered us for today, welcome po. Sana po masihan po kayo sa lahat po ng ating pag-uusapan sa araw na ito. Many things came to a halt during the pandemic, but the training of doctors and nurses and other health professionals did not. Despite the deaths among frontliners, the hospital outbreaks, and the community lockdowns, the medical and health faculty of every school, they have continued to find ways to teach the next generation of practitioners and frontliners, and to prepare with even greater commitment and fervor for our future cases, for future patients. So in this episode of Stop COVID Deaths, we will find out the effectiveness of simulation ng ating mga skills patungkol po sa OB-GYN during this time of the pandemic. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. I was looking forward to co-hosting this excellent program with our adjunct research faculty as a renowned public health communications expert, Dr. Susie Pineda Mercado. Partner, Dr. Susie.
Hi, Raymond. Good afternoon. Magandang hapon po sa inyong lahat. Welcome to everyone who's here. We're just so happy that you're with us, and nakakatuwa sa chat. Nakita ko yung mga pagbabati nyo. We are, what should I say? We are on, ano ba, Raymond?
123. 123.
Oh my goodness. 123. I can't believe it. 123 episodes. And you know, I'd like to greet all of you who are watching on Zoom and on Facebook and YouTube, and those who are catching up through the playback. Kasi what I hear, Raymond, is that there are those who cannot join us at noontime on Friday. And yet, paggabi na or the next day, binabalikan nila yung replay sa YouTube. So binabati ko po kayo lahat, and we hope that you all are learning a lot. We have been learning so much. It's been such a rich experience for us. And today will be no different. We are going to have, oh my goodness, we have one of our haligi ng Stop COVID Deaths. Mamaya sabihin natin kung sino, alam nyo na eh. Pero magandang presentation ngayon. Ano? We, as you noticed in the opening billboard, sabi natin, Stop COVID Deaths. Pero yung current COVID infections. So hindi natin binibitawan yan. And in fact, even for the discussion today, we're talking about this because of COVID. Diba, nahirapan magkaroon ng training. Pero hindi naman pwedeng walang nagte-training, lalo na sa obstetrics and gynecology, diba? So anong ginawa ng faculty ng College of Medicine para matuto, continuous yung learning ng mga students kahit na hindi sila masyadong makaharap ng mga pasyente? Paano bang ginawa doon? So we continue to look at COVID, other outbreaks, viruses, infections, disasters. So we keep an eye out for all of these developments, and I know that, you know, it's not yet, I know that you agree, it's not yet over. Marami pang mga nangyayari. So kailangan we keep abreast of everything that's developing. And we know that you are all very interested in, in the latest developments, both here and abroad, and it's for this reason that we bring you the News Hub.
Thank you, Dr. Susie. And for our first news update, this is one of two po, no? And these are the stories that we keep an eye on and why they are relevant to you. Our first news update has to deal with the question, is it flu, is it respiratory syncytial virus, or is it COVID-19? Kasi po, experts fear that there is what they are calling the triple-demic. So tatlo-tatlo po epidemia. So will the cases of respiratory syncytial virus, COVID-19 and influenza, will they rise together? Public health officials urge precautions while noting that the flu and RSV viruses are simply playing catch up after lockdowns and social distancing. So just when we thought na syempre magka-holiday season na po, medyo palapit na po ang simoy ng hangin ng Pasko, we really need to be more, let's say, cautious And this is because the warning is without basis. Medyo mapaaga po ang flu season for this year. Yung mga hospital po and emergency departments, they are seeing a surge in flu cases and some cases with RSV. Although the COVID-19 cases kumpara from last year to this year, they are trending down. We always have to keep an eye on emerging variants, which something that we hope, and I know you've read about this, something that we could contain po even if there are these emerging Omicron variants that we have. Okay, so we are talking about being able to protect ourselves, really being cautious, staying at home if you're feeling sick, making sure you're up to date on your vaccinations, and wearing a mask indoors. Okay?
Okay, Raymond.
Go ahead, Dr. Susie.
Okay. Teka, bakit nawala yung... Okay. So anyway, from Reuters as of yesterday, no? Moderna is nearing a deal with the US government to develop vaccines against a range of biological threats, including Ebola. So this was reported just yesterday. And, this is very important because Ebola is one of those infections that kills half of the people who get infected by it. 50%, Raymond, ng mga nagkakaroon ng Ebola, kamamatay nila yon, no? Now, it's not airborne. It's not, not contracted through a respiratory mode, but it lives on surfaces. So for several hours, buhay itong virus na to sa mga kutsara, sa mga doorknob, no, yung mga ganon. So, having a vaccine against Ebola is a very big, it's going to be a very big boost for everybody. Our big fear always is that, this happens mostly in Africa, but the fear is, diba, daming conflict doon, daming gera. So, pag nagkaroon ng Ebola in those sites, then you would have a very rapid spread. So, apparently, Moderna and the US government are about to sign a deal on this. And I think this is a very big gain for public health. Currently, there is an outbreak in Uganda. Sabihin man natin malayo sa atin yon, maraming Pilipino din doon sa Uganda. So, good to keep to keep abreast of the news and to know what's happening here and abroad. And that's our news for this week. We'll keep you posted next week on the news update. Okay, tuloy-tuloy tayo, Raymond. I think
yes,
we are, we've got a very interesting topic. Although we were saying, would people be interested in this? Well, actually, we all have to keep on improving on our skills. Kaya importante malaman paano natin gagawin yon, di ba? Kasi kakalawangin tayo if we don't we don't practice our skills. So, what's the best way to do that? Okay ba yung simulation, no? I think this is the question. I think simulation really started with pilots, di ba, when they were being taught how to drive planes. Kasi hindi ka pwedeng mag-crash. You can't make a mistake. And it's the same also with doctors and nurses. You cannot afford to make a mistake. You have lives in your hands. So it's very important to practice the skills, not just to know it in your head, but to practice the skills. So we're going to learn, more about simulation and how the Philippine General Hospital Department of Obstetrics and Gynecology has used this. And to all of our students who are listening, I understand there are a lot who are listening. I hope you will learn from this. So Raymond, we like to also listen to what the people on the ground are thinking and cue natin yung ating persons on the street.
Okay, sige. So Dr. Susie, we usually set our discussion into context, and this for the benefit of those joining us for the very first time, by putting in and showing po this wonderful short video, which we call Person on the Street, just to be able to get the pulse of the common folk on the street po. What we do is we ask questions to these people po and try to come up with a sense kung ano po ba ang tingin po nila based on the question that we pose to them. For this week's question, for the POTS, ano po ba ang kahalagahan ng paggamit ng simulation? What is its value to you? lalo na sa inyong training, lalo na kung training po ninyo ay sa OB-GYN. Please watch this.
Simulation, I believe, from what I have heard or what I understand is it's the application ng nating skills and principles sa classes or sa lectures, ganon, and you apply it to a situation that is not yet the actual, pero something close to the actual na mangyayari.
I see, but iba kasi yung sa actual scenario versus nagbabasa ka ng libro. Just like sa pagpapaanak, di ba? Pag binabasa mo sa libro, feeling mo napakadali na, pero pag nasa actual ka na, mental block ka na kasi ang iniisip mo na yung step by step na nasa libro.
As a pandemic, kasi, medical student, parang limited lang yung experience namin dyan. Actually, ngayon, kaka-experience ko lang ng actual, no? Na parang nagpaanak kami. Siguro, it would have been better sana if na-experience talaga namin ng maraming beses yung mga simulation.
Important siya ma-practice sa dummy muna yung procedure or type of care na binibigay namin. Kasi practice makes perfect, di ba? Para when the time comes na we will do the actual procedure to an actual person, the quality level of care will be of standard and may iwasan yung mga errors.
Well, it's very important kasi it's the transition stage between what you learn, what you read from the books, what your profs, what your educators are telling you. Nakikita mo na nagigauge mo kung gaano ba talaga karami yung natutunan mo, yung na-retain mo sa mga tinuro nila, and how good you will do for the actual patient na mangyayari.
So, yung confidence na mag-handle ng patient and yung parang trust mo na din sa sarili mo na you know what you're doing. Hindi yung first time mo lang gagawin. Although, yun nga, hindi naman all the time na makaka-experience ka ng actual and live patients. So, ayun. Parang it would help you gain yung confidence and parang comfort, magiging comfortable ka sa kung anong ginagawa mo.
These simulations, whether it be virtual or may mga actor patients, it's very helpful kasi nalalaman namin kung gaano kami ka-prepared and nagigauge namin kung ano pa yung kailangan namin i-prepare before kami humarap sa patient.
For us, it is actually very accessible sana if kung wala lang pandemic, no? Kasi inabutan nga kami ng pandemic, ganun, so we weren't able to actually go to school and use the tools and the equipment.
Very high risk kasi and fast-paced ang field ng obstetrics kasi maraming nangyayari at a short amount of time. Kailangan alam mo yung sequence agad-agad, yung steps, yung EINC, yung intrapartum newborn care, ganon.
Siguro yung in general na lang yung advice sa mga mag-med school, kasi 'di ba, well, wala namang madaling course, so you have to really be dedicated. You just have to have a reason why you're doing the thing that you are doing. Sa kahit ano naman yan eh.
The goal is really to be ready for anything that could happen in those situations. Ayun. So simulations will definitely help with that.
Thank you very much, TVUP. Raymond, pinapakinggan ko sila. So, class of 2025, my goodness. I'm really so good na. No, but you know what? I'm listening to them and I was just thinking about what it was like for me when I was that age, no, or doing that work. And, you know, the thing about OB, and kaya believe ako sa mga OB-GYN kasi you're always handling two patients. Di ba, Raymond?
That's
Parang
true. That is true.
dalawa yun sabay eh. Kaya yung sinabi nung isang student na so many things are happening at the same time. Yeah, because you're watching two patients at the same time. That's the only specialization where laging dalawa. No? So, I think this discussion on simulation is really very important because our students have to be ready and prepared and really ready for anything. Kasi maraming bulaga rin yung OB, di ba? Kala mo
That's
okay
true.
lang. Tapos mamaya bigla problema, no? So ako, saludo ako sa mga
For
OB
those
ka.
interns, it's probably one of the more challenging rotations that you'll have.
Oo, di ba?
Mm.
Oo eh. Kasi parang all the pressure is on you. Di ba? Parang gano'n. Oo, so it's good to it's good to reflect on these things, and my goodness, it's the class of 2025. Okay. So Raymond, I think you've got some housekeeping ba?
Housekeeping, some announcements po. Thank you, Dr. Susie. For those who are asking, certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already released certificates for webinars 1 to 121. Very few are remaining for webinar 122, but we hope to be able to complete that, and then we move on to webinar 123, which is for today. If you feel you should have received a certificate but did not, please email us at stopcovidets@up.edu.ph. We will now go to our webinar proper, and for today's webinar, we have a standard panel discussion format. After our speakers are presented, we will have a Q&A session, entertaining questions from Zoom, Facebook, and YouTube, and we hope you'll be able to put in interesting questions po that we'll be posing to our speakers. But before we delve into the webinar, I know everyone is excited dito sa ating very short, cute intro sa ating fun quiz segment.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Ayun, thank you so much.
Natawa pa rin ako, Raymond, pag nakikita ko, natawa pa rin ako eh. Oo. Biglang naging saranggola.
That's true. That's true. Oh, okay. So we have on the screen, both on Zoom and in Slido po, no? The questions that we'll be posing, there are 2 questions lang po, no? For those who are joining us outside of the Zoom, we encourage you to participate sa ating fun quiz by opening up your browsers, typing in slido.com, and when you are prompted, enter the code 5405717. That's 5405717 for you to be able to participate in our fun quiz. For our first question, what are the advantages of undergoing simulation ahead of actual procedures? Option A, the more you practice, the more proficient you become. Option B, to be able to practice in a safe environment. Option C, in the absence of supervision, you can continue learning. And option D, lahat po ng nabanggit. We would like to Okay, thank you po. We would like to greet those who are joining us all the way from Notre Dame Chartres Hospital in Baguio City, from Bataan General Hospital and Medical Center in Balanga City in Bataan, LPH, Mahayhay District Hospital in Laguna, Angel Salazar Memorial General Hospital in Antique, and Department of Health Region 9 in Dapitan City. Those who are joining us, basahin ko lang po, from Occidental Mindoro State College, maraming salamat. From PGH MSS, Medical Social Services, thank you so much po. And we really appreciate that you're taking the time out sa inyong lunch to join us. There are those coming in from the PGH Department of OB-GYN, obviously, thank you po. From the Schools Division of Isabela Regional Office of Tuguegarao Region 2 DepEd Central Office, thank you so much. Those who are joining us from University of Santo Tomas Hospital, Otorhinolaryngology Head and Neck Surgery Endoscopy Unit, and the Center for Kidney Diseases, thank you. They are currently celebrating their Nurses Week 2022. So mabuhay po ang ating mga Pinoy nurses. Nasaan man po kayo. From One Bataan, thank you so much. Dito po sa ating mga colleagues from the University of Rizal System Health Services Unit, and to all those who are joining us from Quirino Memorial Medical Center Laboratory from Pasay City, and New Sinai School and Colleges. For question number 2 reads, what should teachers do to maximize the benefits of simulation? Option A, attention to detail. Option B, supervision in the procedures and patients. Option C, mastery of techniques. Option D, training on how to use simulation for teaching. And option E, lahat po ng nabanggit. All of the above po para sa lahat. So our colleagues and avid viewers, tagapagsubaybay sa ating programa, I'd like to greet them, those who are joining us from Chonin Hospital in Taipei City, Taiwan, Ho Chi Minh City in Vietnam, Abu Dhabi, United Arab Emirates, University of Ha'il in Kingdom of Saudi Arabia, and Lunichi Ali University of Blida 2 in Algeria. We will not be closing our fan quiz po muna so that everyone who are interested can participate. And as we now move on to our webinar proper. Dr. Susie?
Okay, thank you very much, everyone, and thank you for participating in the fun quiz. I hope you're learning in that process. Okay, so let's go to our speaker. Nako, excited na kayo. Excited din kami. And we're very proud of our next speaker. Sariling atin yun, you know. She's really one of the haligi of stop COVID deaths. However, she is also a very well-known obstetrician gynecologist. And she is also currently Deputy Director for Health Operations in UPPGH. Walang iba. Kung hindi, ang laging nagko-closing, ngayon ay main speaker na, si Dr. Stella Marie Legazpi Jose. Stella, welcome to a different
hello, good afternoon, everyone. Thank you for giving me this chance to present this topic. I will now share my screen.
Go ahead po, go ahead.
This is the Augusto Manalo Professorial.
You're on the last slide, Dr. Stella.
Sorry. This is the Augusto Manalo Professorial Lecture. The title of the lecture is The Use of Simulation in the Teaching Learning of Obstetrics and Gynecology in a Tertiary Hospital during the pandemic.
Can you, can you go to slideshow?
Go to slideshow, Stella.
Masyadong excited kasi.
Thank you so much.
Kami din.
Okay. I'm not affiliated with any pharmaceutical company. Parts of my introduction is the onset of the COVID-19 pandemic, and PGH became a COVID referral center, as you all know, and the challenges created in the training of our residents. As a background, there are the domains of learning. So we have the cognitive or knowledge base. So in our department, we have summary rounds every day from Monday to Friday at 7 o'clock to 7:30. Then we have the staff conferences every week, every Tuesday. We have the subspecialty conference when the residents rotate in the subspecialty division, such as gynecologic oncology, infectious diseases, maternal fetal medicine, trophoblastic division, and others. So they rotate in those subspecialties, and they have conferences and journal club in those rotations. And then we have the Wednesday residence hour. Now, in the affective domain, what we want to instill is compassion, honesty, diligence, humility, and altruism. Now, this is strengthened in the group mentoring and the wellness program of the hospital. Now, the psychomotor domain is the action-based part. No? So it is the ability to physically manipulate a tool. No? So it can, or an instrument, for example, like a hand or a hammer. And the psychomotor objectives usually focus on the clinical part and the development in behavior and or skills. Okay? So they focus on change and or development in behavior or skills. Now, I want to show to you the hierarchy of the psychomotor domain. So first, there is the perception of the trainee, so how the instruments feel. Then it becomes, there are sequences of events that must be learned by the resident trainee, and that is the set. Now you have the guided response, and the consultants guide the residents in their training, in the simulation training. Then mechanism happens when the steps are so already memorized by the resident that it becomes almost mechanical. So it becomes automatic. Now, complex overt response is, for example, you're in the OR and something different happened. For example, the ultrasound showed an ovarian cyst, but when or ovarian mass, but when you opened, it wasn't an ovarian mass; it was something else. So your response to that situation is developed, no, in this hierarchy. Adaptation is when, for example, you're in a different situation, for example, a medical mission, and the instruments there or the sutures are not the same as what you were used to. You learn to adapt to that situation. And of course, the highest is origination. So you invent a procedure. Right? So that is the highest in the hierarchy. So as a background, our first year residents assist in the minor operations of the more senior residents. So for example, dilatation and curettage for a miscarriage. So what is honed here is the concept of repetition. Then the outcome of this, the first year resident now memorizes the steps in the procedure and writes it in the OR technique. Before there was still no radish, so we just wrote it down in paper. But now there is the radish, which is the records of admissions and discharges of the Philippine General Hospital, and this is our EMR. Now, at the end of it, the first year resident will do the procedure assisted by a more senior resident. Later on, the first year can do the procedure independently. Now, for the second year resident, these are the skills that they should learn. Vaginal breech delivery, which is quite difficult, no? And curettage, vacuum assisted delivery, forceps delivery, and classical cesarean section. Now, again, the second year assists the senior resident in the procedure and memorizes the steps until she can write the procedures herself. Now, we have the training officer, the consultant, who is in charge of the training of all the residents. So the training officer assists the second year in her first vaginal breech delivery. Then, when the resident passes, she completed all she knows the procedure already. Now, the assistant chief resident or the team captain assists the second year resident. Then later on, the senior resident. Now, when PGH became a COVID-19 referral center, only COVID-19 patients were admitted. So if the patient is a non-COVID patient, to be admitted, the patient must be in a life-threatening situation. For example, placenta previa and the patient is bleeding profusely. Or, for example, the patient is eclamptic. No? So what is the result of this? The result is the drop in the number of admitted patients. Now, in our society, the Philippine Obstetrical and Gynecological Society has requirements for residency training. So I just placed here for the first year and second year, these are the following. So for example, the normal spontaneous delivery, for the first year, the requirement is 50 normal deliveries for each resident. And for the second year, 20 normal spontaneous delivery. Episiotomy, 25 in the first year and 10 in the second year. Outlet forceps extraction and or vacuum extraction, 15 for the first year and 15 for the second year. You know, this is very important because when you know how to use the outlet forceps and vacuum extraction, our CS rates will naturally go down because you will not jump at once to doing a cesarean section when a vaginal delivery is still possible. So that is a very important tool, important skill to master. And dilatation and curettage, 20 for the first year and 20 for the second year. So you'll see it's all very structured, all the requirements. So when you search the literature in this study by Treadwell and Gobler, they said that students found simulation useful. The simulators and models provided a structured learning experience. So everything is parang dekahon, no? It's structured. There's a feeling of security. The parameters were clear. The steps must be followed. Repetition of skills until it is almost automatic. That's what I meant earlier, no? when you do the skill so often, for example, riding a bike, when you ride the bike, surely when you do it so often, you won't be afraid to ride the bike anymore, no? And precautions must be taken before the actual performance of a procedure. That's very important. And students, in this study, the students recommend simulation for all, and it must be done before the actual clinical rotation. So when you say clinical rotation, these are live patients already. So the students must be well versed in the procedure before handling the patient. Now, in another study, the trainees were better prepared, so they found out that it improved the trainees. So beforehand, so they were more productive and better prepared for the rotation. So they're not in a panic mode, no? They are prepared. To protect the public, the trainees acquire the necessary competencies before doing patient care. And the trainees must be supervised by professionals during their clinical rotation. So, here in PGH, we are very particular about this. The consultants must supervise the residents. And we even have a sheet that we have to sign if you have assisted in the OR of your resident in all departments, all cutting departments, submit that. Now, in obstetrics and gynecology, we have our academic affairs committee in our department, and they categorize the different procedures for the different year levels based on the CREED manual of operation. CREED stands for the Council for Residency, Resident Education, Enhancement, and Development. So they are in charge of the residency training program, this group of consultants. Now, the simulation is done in the first year for first year residents. They should know how to do spontaneous vaginal delivery, essential intrapartal newborn care, pap smear, pelvic examination, intrapartal monitoring, curettage, suturing, and hand tying. So, for example, the EINC, you know that EINC has saved thousands of lives of newborns, no? Because there is the early latching on and the delayed cord clamping. Just the delaying of cord clamping increases the blood volume to the baby by 70 ml. And that is very good to prevent anemia in the newborn. Now, of course, pap smear, it will detect cervical cancer. And here in the Philippines, cervical cancer still remains to be high, because it is not all over the country. It is not uniformly done, that pap smear must be done. And intrapartal monitoring, the patient is hooked to a monitor and you read the tracing. You know when to intervene, when to give, for example, oxygen, or when to do a cesarean section because of this. And of course, curettage in miscarriage and suturing and hand tying. Now, I will show you a video of an actual simulation that we had, and these are first year residents. So you see that we have the first year resident trying to suture the episiotomy. So this is a rubber dummy, and you see that she's having quite a hard time putting the needle in because the consistency of the simulator is not the same as the actual patient. In an actual patient, this is very soft, and you cannot be putting your needle in and out because that will create a very bloody, bloody. So you can hear my voice. So I'm the consultant who is assisting her. Okay, so she's doing the knot tying. So look at the left hand. The left hand is steady and only the right hand is moving. So that will ensure that the knot will not get loose. Then after that, she will again do the suturing. Okay, again. So you see, when you insert the needle and then you pull it out with your left hand, you should follow the curve of the needle. So in this one, so because it's her first time, you see she's having a hard time getting the needle. The needle is curved. So you have to follow the curve of the needle or else it will break. inside the patient. So you see, no, that's why simulation is really very important because you cannot be doing this in an actual patient. The steps must be sure. And yan, sabi ko, ulit. Okay. Okay, so that is suturing in an episiotomy. Wait. So now here we have closing of the fascia, the rectus abdominis fascia in a cesarean section. Okay, so this is also important, the closure, because there are many complications if it is not done properly. Okay, so you can have bone breakdown or infection. So she's doing knot tying. Okay. And she's locking the knot so that it will not get loose. And there's a system to it, no? That the distance from the edge of the wound and the distance of the sutures. So there should be uniformity, like 1 cm apart and 1 cm from the edge. Of course, in an actual patient, she's wearing gloves, no? And this one, because it's still simulation, that's why we allow, but it should be that the resident is wearing gloves, even in the simulation. So see, no, the resident has many extra movements, and you know that in an actual surgery, that will take up your time and the patient will be bleeding. Remember, that one that she is suturing the fascia, it can also be bloody. I mean, it can be a bloody procedure if it's done that slowly, no? You should be, yeah. So now she's learning. So you see, no, if you do it repeatedly, you will learn the proper technique, no? So there, I'm assisting her, and I'm the assistant. Okay. So she will finish that for the whole fascia. Now we go to the secondary residence. So these are the requirements that we will do simulation during breech extraction, curettage, vacuum delivery, forceps delivery, and low segment cesarean section. So in a breech delivery, there are certain maneuvers that need to be followed so that the head of the baby will not get entrapped in the uterus of the mom. Now, what you will see here is a recording that the residents must watch first before they do the simulation.
This video demonstrates how to do suction curettage. Once bladder has been emptied, pelvic examination is done. Retractors are placed and the anterior lip of the cervix is grasped with the tenaculum forceps. IV oxytocin is started.
I'm sorry. I'm sorry. I accidentally. How do I do this? Monica, help. Wait. It went forward. Wait. Sorry. I think. Wait. I have to stop share and wait, and share again. I'm sorry for this.
Okay lang, Stella. Okay lang.
Ayan, okay.
Yeah, go ahead. Go ahead. It's fine.
It's there. Sorry.
This video demonstrates how to do suction curettage. Once bladder has been emptied, pelvic examination is done. Retractors are placed and anterior lip of the cervix is grasped with the tenaculum forceps. IV oxytocin is started.
Before she continues, no, the patient must be in in semi-Fowler's dorsolaterotomy position. So the patient's head must be a bit elevated. This will prevent embolization of the trophoblastic tissues to the lungs. We have seen patients that even before the procedure started, the patient coded already. So that happened before, but now it doesn't happen anymore because we follow all the precautions, and that is what we teach to our residents. So in this video, you will see that suction curettage, there's a cannula that is used, no? And the cannula will there. So the cannula will make sure that the uterus is fully emptied. Nothing should remain. Okay, so for the third year residents, wait, uh,
This video demonstrates how to do suction curettage. Once bladder has been emptied, pelvic examination is done. Retractors are placed and the anterior lip of the cervix is grasped with the tenaculum forceps. IV oxytocin is started and gradual evacuation of molar products is done by suction curettage, while the other hand palpates the fundus. Suction cannula was gradually and gently advanced into the uterus with rotational movement until no more vesicles were suctioned. Proceeded with careful blunt, followed by sharp curettage in a clockwise fashion. Anterior cervical lip was released and retractors are removed and internal examination is reviewed.
So that is suction curettage, no? And that is a very delicate procedure, if you ask me, because the uterus is very soft and you can really perforate if you're not careful. Okay, so the third-year resident now gets the more complex simulation exercises. We have the uterine artery ligation, suction curettage, classical cesarean section, myomectomy, the B-Lynch procedure, the Heyman's procedure, and the shoulder dystocia procedure. So these are all taught using simulation. Now, for the fourth-year resident, we have the bilateral internal iliac artery ligation, which will stop blood loss. No, in OB, it's really a very bloody thing. So I mean, if you're not careful, then the patient can hemorrhage right there before your eyes. No? So these are very important procedures for the residents. So the B-Lynch, and then we have the pelvic organ prolapse quantification. Okay, so this is the video of the B-Lynch procedure using a dummy. The one doing the procedure is one of our assistant chief residents, Dr. Mario S.P.
When procedures are in place, compression sutures are secured. Without initially.
So the B-Lynch compression suture is used when the mother has uterine atony. Okay, so the uterus is soft and flaccid and she's losing so much blood. So this is a very good procedure, especially in emergency situations. Now, notice that the cesarean section is still it's still open. So after the B-Lynch, you will now close the uterine incision. Okay. Then next we have the Heyman suture. This is like a modification of the V-Lynch. This one is here. So this is also a compression suture. No, because it is a dummy, no? So it looks easy, but it's not easy. The placement of the suture is very important. Should be so many centimeters away from the big vessels. Look at the big vessels, no? If you nick that, you'll have hemorrhage, so tremendous hemorrhage. So he's just making it look easy, but you have really to practice this in a simulator. You cannot start doing it on a live patient. That's not fair to the patient.
And this on the lateral side, the ear wall and exits through the skin wall. This will then compress the uterus. As the sutures.
So doing this procedure, you will prevent further hemorrhage, and you can you will not the patient will not undergo hysterectomy anymore if the bleeding is stopped. So it is a life-saving procedure.
Now perform things. Now we performing the.
So how do we grade our residents? So we have the performance checklist. For example, in this case, suction curettage. So we have a patient, a 28-year-old Gravida 2 Para 1 1001, who had spontaneous vaginal delivery for her first pregnancy without any fetal-maternal complication. Now, for this pregnancy, the age of gestation by last menstrual period is 16 weeks. She had a history of vaginal bleeding, and on internal examination, the corpus was enlarged to 22 to 24 weeks, and ultrasound showed H4. So if you look at the history of the patient, The AOG by menstruation is 16 weeks, but the IE showed an enlarged uterus. No? So it is not compatible with the last menstrual period. So even without ultrasound, you will already think of H-mole with this patient. So this is how you grade the resident. So in the performance checklist, the step was done satisfactorily. The resident gets 1 point. If it's done with minor correction, 0.5 points, and if it's not done, 0 points. Now, as I mentioned earlier, after anesthesia induction, the patient must be placed in semi-Fowler's dorsolithotomy to prevent embolization of the trophoblastic tissue. And then, so that is 1 point if that is done. And since the risk of bleeding is high in uterine size 16 weeks and above, you have to have blood available. So before anything is done to the patient, blood should be procured and properly cross-matched at the start of the procedure. Now, mechanical cervical dilatation is done if the cervix is unyielding. So you cannot introduce the instrument if the cervix is closed. Okay, so what are the results of this? Now, in the cognitive domain, all our 4th-year residents passed the rigorous Part 1 examination of the diplomate exam of the Philippine Obstetrical and Gynecological Society. So we had 16 out of 16. Now, in the affective domain, the OB-GYN department garnered a score of 96% in the patient satisfaction survey. Now, what about the psychomotor domain? Before the pandemic started, in 2019, our maternal morbidities were 0.3% and maternal mortality was 0.17. We had admissions of 5,213 admissions. Now, in 2020, the this was already the start of the COVID, and our admissions were drastically halved. No? So we had 2,807 admissions, 0.61% maternal morbidity, and 0.21% maternal mortality. What about in 2021? So in 2021, our admissions went down further to 2,344, and the maternal morbidity is 0.81, and the maternal mortality is 0.81%. So you will ask, so how come, since we already started with our simulation full blast during this time? The answer was because 2020 onwards, there were less patients served because PGH became a COVID referral center. So the denominator is lower. No? So of course, you cannot strictly compare it to the pre-pandemic levels. Now, more mortalities were due to COVID rather than surgical morbidities and mortalities. The patient came in late in the course of their COVID illness. Many patients were rejected by other hospitals, and PGH was their last resort. You know, I have seen patients who were rejected by 5 hospitals before they arrived in PGH. And, you know, moving from one hospital to the other, the patient really lost time already, you know. So, but by the time they reach PGH, they're so far gone in their illness. Then in 2020, we had the Delta surge, and the mortality was really high at that time. So the conclusion of my paper is simulation has an important role in the teaching and learning of obstetrics and gynecology. The clinicians deal with life and death of their patients, and simulation will help ensure that every graduate of the Philippine General Hospital residency training program has the clinical competence and surgical skills for the welfare and safety of the patients who they serve. I would like to thank those who helped me, Dr. Patrick Padilla, Dr. Mario Espino, and Dr. Marta Rosa, who helped me with the videos. Thank you very much also to TVUP for giving me this opportunity to give this lecture. Thank you.
Uy, thank you very much, Stella. My goodness. Caymans, hindi natin alam yun, Raymond. Bago yun, It's a very interesting presentation, Stella. And I think for those who are just seeing this now, they can go back and watch the video again, no? The videos again. I thought that was really fantastic. Okay, so we have some reactors. Raymond's going to start with our first reactor. Go ahead.
Several reactors for today, and thank you, Dr. Stella, for your professorial lecture. Our first reactor for today is Dr. Erlyn A. She is, she used to be the former dean, but still a professor at the National Teacher Training Center of the for the health professionals, for the health professions at the University of the Philippines, Manila. Please welcome her to the screen. Thank you.
Thank you, Dr. Raymond, and good afternoon, everybody. I would like to share my screen.
Go ahead, ma'am.
Thank you.
Ayan po. If you could go to slideshow.
So first of all, it's okay na?
Yes, ma'am. Go ahead po.
Magandang hapon po ulit sa inyong lahat. Thank you, Dr. Jose, for inviting me to give my reaction on your Augusto Manalo Memorial Lecture, a professorial lecture. As I listened to your presentation, I think I was able to come up with a few ideas, and I'm summarizing them as your key messages. The first key message that I think I identified is good news. Good news because residency training in OB-GYN and PGH continues even in the midst of the COVID-19 pandemic. The second good news is that while the training continues, it's only the teaching and learning platform that's changed. The ends in mind are the same. So the outcomes, the competencies that we expect from our resident trainees remain the same. And that's good news because we can be assured that our next cadre of OB-GYNs will be as competent as their faculty members. The third one, of course, is an appreciation of the role of simulation in skills acquisition, which is the focus of your lecture today. And then last, I have two take-home lessons that I think it will be worthy of our reconsideration in attending to this program of training the residents. So as I was listening, I remembered the classic book that we use at NTTCHP. This is a prose discussion, philosophical prose discussion of Abner Pediwell. This is also his pseudonym. The title of the book is Saber-Tooth Curriculum. You can see it's just $1.50 kasi super luma na po siya. This was published in 1939, but a prominent curricular theorist, John Goodland, described this as the book that changed the way we view education. The book is about a Paleolithic stage, a community that trained a Paleolithic community, Paleolithic age community that trained the younger generations on how to drive away the bears that visit their houses at night and destroy their lives and their houses. So the curriculum focused on the training of the saber-toothed tigers to drive the bears. So you can imagine the application of training the tigers to drive the bears, and the young people will have to master the skill. Then over time, of course, the bears and the tigers became extinct, and there were new challenges in the community. And then there were younger people, younger academics, who insisted to debate with the magi's, with the elders, the wise old men, and demanded that the curriculum be changed. And this is a quote that I would like to say. The wise old men were indignant. Their kindly smiles faded. If you had any education yourself, they said severely, you would know that the essence of true education is timelessness. It is something that endures through changing conditions like a solid rock standing squarely and firmly in the middle of a raging torrent. As a country, we can name several challenges. We had pandemics, we had experienced wars, difficult conflict situations, and you will say, I think you will agree with me that over time, after a couple of days or months of being distracted, the school is one of the institutions that restores themselves, because they have a mission to fulfill, to continue training the younger generations. And in the case of the human resource for health, the training hospitals have to continue training the people, especially now, because we need to be assured of competent supply of human resources for health. The second good news is that as the training in OB-GYN and PGH continues, only the teaching learning platform changed and the program outcomes remain the same. This is a very good assurance that our OB-GYNs will remain competent. I remember the joint circular of the Commission on Higher Education and the Department of Health, number 2021-004, giving us the guidelines on how we will conduct our classes, especially as we go back face-to-face. But in the case of residency training, parang hindi naman sila tumigil, but they needed to change the format. Tapos, the Department of Health even issued a new normal, a manual for the new normal for health, saying that life will have to go on. And in good times and bad, this training has to continue, but with the same ends in mind. I would like to also share with you the proceedings of the National Academies Press of the United States. This is a manual documenting the workshop proceedings, and it's entitled Health Professions Faculty for the Future. This manual recognizes the pandemic that we are all in. It was published in April 2021. And because the circumstances are different now, the manual challenges all faculty in the health professions for the future, but this is now, to engage in knowledge translation activities, referring to the attempt of all faculty members to reinvent knowledge, including the teaching of knowledge, skills, and attitudes, so that in a given period of time, in a particular teaching learning context, training and education will continue. So this is a very good assurance that our faculty members in the Department of OB-GYN, in their own way, are discovering knowledge translation activities so that the training continues without sacrificing quality. The third message that I would like to also share with you is the special appreciation of the role of simulation in skills acquisition. Even before the pandemic, we already recognize the value of simulation. Siyempre, dinisita na ni Dr. Stella Jose yung ating taxonomy of the psychomotor domain of learning, beginning with the basic step of perception all the way to the highest level of origination. I'm assuming that the videos that we have seen performed by first year and second year students are pre-simulation activities. They are considered pre-simulation because they are not yet real simulations. The pre-simulation, they are practicing the step-by-step procedures. They have to mentally coordinate their hands and their other faculties, perform the step-by-step procedure, and in doing so, they're trying to identify what possible areas they can commit mistakes and how they will be troubleshooting the process. When we are doing the real simulation, we expect that the learner or the trainee is performing in the closest possible teaching learning environment. Dr. Jose has been saying, in real setting, when they do simulation, they are in the real lab. So they will be wearing gloves, they have time element in consideration, and they are conscious that there can be bleeding, there can be bulaga, as Dr. Pineda mentioned. So you see, in simulation, we are priming our students to have this structured teaching learning experience so they master the skills from step one to the last closing step. And this is supposed to prepare the trainees to achieve a certain level of automaticity. And when they reach that level, they are ready to deal with real life patients, and so they will be allowed to perform in workplace setting. And in this particular instance, they're dealing with patients, so they have to be prepared with all other preparations. But the most important thing in simulation is the quality of supervision. During the video recording, we heard voices, and Dr. Ste explained that she was the one doing the coaching. During the interview with the spots, one of our medical interviewees said that as we practice, we can reach perfection. But in the real skills acquisition, especially in this very complex situation of OB-GYN training, that may not necessarily be true anymore. Okay, you can repeat and repeat the skill. You can perform the skill again and again. But if there's no one of a more knowledgeable person that will tell you you're doing this thing wrongly, then there's a chance you will continue the wrong procedure again and again. So in this time, especially that we have limited opportunities to perform the procedure, it's impossible almost for the trainees to meet the threshold procedure number for every procedure. Even performing once with the correct provision, with the correct quality supervision, the trainee can acquire the right skills, the right maneuvers, because it was done correctly and it was affirmed by the supervisor. Okay, so that will be very important to this period now that we have limited opportunities to perform the procedure. Lastly, what are I only have 2 take-home lessons to share with you, and I'm sure I'm giving you a quote from a favorite author on curriculum design. Mars declared that curriculum starts as a plan. It only becomes a reality when teachers implement it with real students in real classrooms, including laboratory and simulation schedules. Careful planning and development are obviously important, but they count for nothing unless teachers are aware of the products and have the skills to implement the curriculum in these classrooms. I'm very happy that our teachers in the Department of OB-GYN know the ends in mind, and in good times and bad, they can carry out different creative opportunities for the trainees to implement the curriculum, especially the OB-GYN residency training. And the last point I'd like to say is that the journey towards clinical specialization in OB-GYN, PGH, is never a bed of roses, never a bed of roses. And the COVID-19 pandemic made the journey challenge even more challenging. But with the Department of Obstetrics and Gynecology proving its resilience, I will still be a most willing patient that will submit myself to this team of women's best friends and doctors. Maraming salamat po.
Wow, ang galing naman ng presentation ni Dr. Erlyn, palakpakan naman natin yan. My goodness.
Maraming salamat po.
Iba talaga pag dean ng National Teacher Training Center, di ba? And we always say this, Ma'am Erlyn, we say this in the webinar na, you know, we need lahat ng talino kailangan natin para sa pandemya. And for me, it was very clear na ang pagtuturo hindi yan basta-basta. May structure, no? Pinakita niya kung paano, step by step, tsaka you were unpacking every part of it, which I think is a good reminder for all of us, because all people in healthcare are inherently learners and teachers. We never stop learning and we never stop teaching. So thank you so much for that perspective. Okay, we have another. Thank you very much po. Another reactor. Naku, matagal ko nang din nakikita to eh. Pero sasabihin ko sikreto, classmate ko nung first year college, mga teenager pa kami. Sa English yata, sa UP.
Pre-med.
Pre-med, yeah. I'd like to welcome Dr. Nikki Atienza, who is the Dean of the College of Medicine of San Beda College. And he's going to tell us about how they're using simulation in San Beda. So, Nikki, so nice to see you after 20 years, kunyari, di ba? Yeah. Nice to see you and nice to hear from you. And sige, ano bang ginagawa niyo sa San Beda? Go ahead.
Okay, good afternoon, everyone. Good afternoon to my classmate, Dr. Stella Jose. And our mentor, Ma'am Erlyn. You know, in San Beda, we have no hospital of our own. We have 650 students, and the fourth year are rotating in Quirino Memorial Medical Center. But previously, we would actually bring our third years and second years also to Quirino Memorial Medical Center. But during the pandemic, here we are at our San Beda campus. And if you could look at the next slide, San Beda is run by the oblates, the monks of the Order of Saint Benedict. And we have here the first thing that you will come when you enter would be the Abbey of Our Lady of Montserrat. And so we actually have our first 3 years of medicine on campus. And if you look at the next slide, one good effect of the pandemic is that we have a new College of Medicine building. And the first activity that we had, which was May of this year, was devoted really to simulation. So currently, all our lectures are delivered online, except the exams and the simulation activities. So we have new classrooms, new chairs, and new ways of doing things. And if you look at the next slide, we owe our advances to different departments in the College of Medicine. And we started by orienting our students on basic precautions, masks, how to wear gloves, how to don a PPE, so that when they enter Quirino for fourth year, they would not be so afraid of the need to go on duty. So this was done on campus. And in the next slide, we went ahead, led by the Department of OB, on the OB-GYN skills training. So we were prepared to buy from the market slabs of pige or liempo, the way we used to do it. But as it turned out, they came in with some materials that they purchased from Shopee. So to our surprise, they could actually buy suturing sets and itong skin with already wounds already there for them to repair. And so it was a fun training. No, they also learned how to do knot tying, probably simulating what it would be if you are assisting an OB-GYN closing a cesarean section, for example. And in the next slide, to our surprise, the faculty asks, or they ordered also from Shopee, these car wash sponges, colored yellow, and they asked the students to take out the pentel pen and draw maybe the perineum and the site wherein they would expect to find the mediolateral episiotomy, something like a second degree episiotomy in need of repair. So the workshop here was a repair of episiotomy, or the episiotomy workshop, and I heard it was something really quite memorable for these were third year students. And in the next slide, we also purchased these simulators for which the faculty could actually engage the students. And this was one thing that was so appreciated by students who had not seen their mentors, their faculty for 2 years. All of a sudden, they're in front of our OB-GYN consultants, 1:1 ang kanilang teaching, teaching them about how to do the Leopold's maneuver, how to do internal exam. I believe these mannequins are equipped for doing internal examination to palpate the fontanelle of the baby and to be able to see if it is in breech position or whether where the occiput is. So both presentation and lie. And in the next slide, they would actually simulate the entire delivery process and dictate or recite the expected events during labor. And of course, they're also trained on how to catch and not to drop the baby. So we could actually even see the umbilical cord here with these simulators. Okay, for the next slide. Then later on, we actually bring our students to a surgical skills training center somewhere nearby, near Quirino, wherein they would actually be trained in doing certain procedures, like, for example, endotracheal intubation, intravenous catheter insertion, or Foley cath insertion, or insertion of nasogastric tubes. So this would be an activity for which they will gain a certificate, which would be required before they start their actual clerkship. So our dream in San Beda, well, we are still hopeful that one day we will have our own hospital. But we could actually start with the simulation process. And if you look at the next slide, we are currently pursuing the construction of our own building, which will include a simulation floor and a structure for interprofessional training together with our nursing counterparts. So yes, this is for the future. We are hoping that the students will be encouraged more, even just to apply for residency, because many of our students are hesitant to apply for residency training because they feel they are not ready, they are not equipped, or they are simply overwhelmed, by the demands of the work. But I do believe that simulation is important to adequately prepare even residents for their training, so that when they graduate, there would be less need for them to undo certain errors that they may have learned during their education, or that have been surpassed by new, more advanced technologies. So, well, this is my last slide, but our faculty in San Beda, many of us owe our formation, our training, our development to UP Manila. And we are just so happy to be participating in activities such as your show, Susie, And we are watching. We hope you have 100 more of these, by the time the COVID ends, this pandemic. Thank you very much. That would be all.
Oops. Thank you so much. That's Nikki Atienza. Uy, palakpakan natin. Ganda rin ng presentation, Raymond, Sa San Beda. Kahit wala silang hospital, talagang, talagang lumalaban eh. I really appreciate it, Nikki, and all the photographs. Diba? Parang talaga, it really shows na tayo in the Philippines, we can we can make things happen eh. Diba? Parang hindi tayo nauubusan ng ng talino pagdating dun sa problem solving. So thanks, Nikki, and stay for the Q&A. Yeah, congratulations on all your work. Okay, we have another reactor, Raymond.
Yes, okay. Ang galing ng Quirino Memorial. Tumutulungan nila si San Beda.
Cute, no? Ganda eh. So binabati natin mga taga-Quirino. Maraming taga-Quirino nanonood ngayon.
That's true. So thank you again, Dr. Nikki Atienza, Dean po sa San Beda University. University na po ngayon ang San Beda. So maraming salamat po sa inyo. He's the Dean of the College of Medicine there po. And now for our final reactor, she's also an OB-GYN and former Dean of Pamantasan ng Lungsod ng Maynila College naman po of Public Health. Please welcome to your screens, Dr. Teresita Cadiz-Brion. Dr. Tess?
Yeah, thank you very much, Dr. Raymond, Dr. Susie, and of course, thank you to classmate Dr. Stella and classmate Dr. Nikki. No, good afternoon, colleagues and friends, and thank you for allowing me to be in this forum with you. Let me just share my screen. I think you're still sharing your screen.
Not anymore, ma'am. Go ahead po. Okay, there we go. Thank you po. Go ahead, ma'am.
Okay, so again, thank you. Simulation for teaching clinical skills, as we have heard from Dr. Stella and Dr. Nikki, is very good, no? In that it is able to control training and exam process. It can also control training logistics. And trainees can learn from their mistakes in a safe environment without hurting any patients. And the trainee can also practice the skill as many times as needed. Although we take note also of what our advisor, Dr. Erlyn A, says, that for it to be good, there should be an evaluator who can check the mistakes so that the skill will be practiced well. No? Yung tama dapat ang lumabas. Now we see that simulation can be done in a lecture return demo process. And this is what we know as the tell, show, do. And I must say there should be evaluate also, no, to go with the tell, show, do. And this is in different phases, 3 phases. Simulation can be accomplished in this way, and this is okay for the face-to-face, but we know that in the year 2020, the world experienced another 911, wreaking havoc in all the aspects of our lives, including education. Now, for this afternoon, allow me to share with you the experience of the PLM College of Medicine, Hospital ng Maynila Medical Center, as far as simulation of the EINC birth was during the pandemic. PLM College of Medicine was the first medical school that underwent training for the EINC delivery way back in 2011. And it has been teaching EINC, birth from then up to the present. Dr. Alice Bautista, our academic training officer and faculty in the Department of OB-GYN, had been teaching EINC birth to clinical clerks from that time, 2011, up to the present. When face-to-face classes were transformed to virtual, she had to find a way to teach this important procedural skill. And so she created a birthing simulator from easily available materials similar to the more expensive birth simulator mannequin. And also, she also created a perineal repair model from an ordinary sponge, much like what Beda did. The pelvis was a box with the landmarks identified. The fetus, christened Vida, was made of a cotton body and fiber fill, with an ordinary cord and a round rag for the umbilical cord and the placenta. Enough models were made for the class. They were packaged in OB training kits and then sent by courier to the trainees. An orientation was conducted and a teaching video tutorial, as well as the rubrics for the evaluation were given. So you can see here that the rubrics contain the different steps in the procedure. As a final output, a video recording of the return demonstration by the trainee was submitted using the YouTube Unlisted after 4 weeks of training. This was used also as the post-test. Allow me to share their outputs.
The sides of the head are grasped with 2 hands.
This is the clinical clerk doing annotation of the procedure that she's doing.
Arch. Gentle upward traction is applied to deliver the posterior shoulder. The rest of the body almost always follows the shoulder without difficulty. The sides of the head are grasped.
This is for the suturing.
Care of the perineum requires good lighting and visualization, proper surgical instruments and suture material, and adequate analgesia. Ensure that the tissues are well infiltrated with local anesthesia using 2% lidocaine. Check for heavy bleeders along the laceration. The apex of the vaginal laceration is identified. An anchoring suture is placed 1 centimeter above the apex of the laceration. Tie the stitch with 3 interlocking knots using instrument tie.
So this continued, and the mentor, trainer, gave feedback on the video that was created and submitted.
Pair of the perineum requires
So for 2020 to 2021, this worked quite well. However, the courier expense became an issue afterwards. So what happened was the trainees themselves were asked to create their own EINC birth simulator, very much similar to the original prototype, as you can see here. And makikita natin, no, na samut-saring mga baby at umbilical cord ang lumabas. Naging furry friends na sila pagkatapos, no? Now, using the rubrics, again, even for this, the teacher gave feedback to what was being done and what was being submitted. Okay, just a second look at the rubrics, and you can see that the steps are really clearly delineated for the EINC vaginal delivery as well as the episiotomy. Now comparing the demo-return demo simulation strategy before in the face-to-face and now, we can see from our previous presentation that actually all the learning outcomes were also fulfilled. It also fostered creativity and resourcefulness, which are the higher order thinking skills that we all aim for as learning outcomes. In 2022, a limited face-to-face began. And the feedback of our trainees is that after they have experienced the virtual EINC delivery, they were able to perform it better in a face-to-face simulation. Here you can see that there's already an actual teacher who is evaluating and ensuring that the finer points of the EINC delivery steps is evaluated. And these trainees moved on to do actual patient deliveries, and by now will be ready to take the board exam. And they said that it really made a difference that they were able to practice virtually, even in makeshift simulators. Indeed, if one is determined to learn, no one can stop you. So before I end, I would like to thank most especially and recognize Dr. Alicia Bautista, who conceptualized and carried out this module for EINC delivery, earning for her a Best in Dissertation Award. Likewise, I would like to thank our chairman and Dr. Carolina Paula Martin and the rest of the Department of OB-GYN staff for ensuring that learning occurs at its finest, pandemic or no pandemic. Thank you very much for listening.
Thank you very much. Teka, palakpakan naman natin PLM. Grabe. Ang galing, ang galing. Techi, very, very nice. I love the part where the students have to make their own video to show how they learned it. I mean, this is really showing us talagang the best in the Filipinos, no? Na parang talagang gagawa tayo ng paraan para matuto, no? And I just love that idea that they have to make their own video. That's amazing. Tsaka sending them kits, that's also amazing. So congratulations and thank you so much. That was very, very enlightening.
Thank you. At lalo na siguro na pagkatapos noon, sila na ang gumagawa. Actually, yung second part, sila na yung gumagawa. Kaya meron na tayong mga staff toys na lumalabas doon sa...
Oo nga, iba na no? Parang
mga PLVs.
Maganda. Really very, very imaginative, very creative. And that is what we need, no, when we're in crisis. Na di tayo nawawalan ng pag-asa, gumagawa tayo ng paraan. Anyway, Raymond, we are now moving into our panel discussion, but we're actually running out of time. We'll only do 2 questions, I think. But before that, I think, Raymond, you're gonna cue the public service announcement. Uy, wala si Raymond. Raymond, wala ka ba dyan? O sige, let me cue. This is our public service announcement for today. TVUP, please go ahead.
Aloy, bilisan mo! Dali!
Wala.
Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate. Nabakunahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yay!
Sisiw!
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the Stop COVID Deaths webinar team for us to push for pediatric vaccination for children aged 5 to 18. We hope you can share this message to all of parents, guardians, carers of children, and to all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. We also understand that everyone has busy schedules po, no? So what we did was to be able to put in very short and consumable videos that we lovingly call SCD shorts. You can find them if you go to www.youtube.com/TVUPPH for you to be able to see all of the nuggets of wisdom contained in this very short video. Sana po, if you have the time, you'll be able to see this kasi po mas maikli po siya than the videos that are archived para po when you go to the playback. So to start the ball rolling for our panel discussion, I'll turn the floor over to Dr. Susie.
Thank you very much, Raymond. And then I think we can only take one question. But
Yeah.
we're going to ask our panelists to kindly open your cameras. Tama ba yung camera? Yes. And I'll just start with a very simple question and get quick feedback from everybody. I was really struck by what one of the students said earlier on persons in the students on the street, no students natin, that confidence is very important. So it's one thing to learn skills. It's another one to feel confident. So I wanted to ask each of you, like, what do we do to help our students develop confidence? So, okay, nagpa-practice, nagbabasa, nag-aaral, pero paano nila ma-overcome yung kaba na baka meron silang masaktan or mali ang gawin nila? How do you work on that? So we'll start with Techi from PLM. Go ahead, Tech.
Usually during the orientation, we do tell them that the reason for the simulation, and of course we also have professional patients, no? Pero yung professional patients, dahil wala ngang pera pambayad, yung mga teacher yun na ang professional patients, no? And we also have mga AVP presentations where cases are also being given, and tinitingnan doon yung more of the affective, no? Paano ba, kung masungit ka ba, tama ba yon, no? Mga things like that. Anyway, so what they have to accomplish is really internalize this, no? Practice it so that the confidence will be there. So how will we teach them? How will we ensure that they have the confidence? Siguro yung evaluation natin, no? So sa amin meron kami mga evaluation sa cognitive skills, sa affective skills, no? And of course knowledge, no? Pero do sa skills, pag nakita nila na maganda ang grade nila, at fini-feedback naman, dito mali ka. Bakit mo kinat yung cord kaagad, no? Something like that. Doon, I think doon makukuha yung confidence. Pag nasabi na sa kanila na, okay, 100% ka na, ito na yung kulang, I think they will have the confidence. At yun naman yung na-experience namin, no? Yung mga nag-virtual at saka nag-simulation sa face-to-face, pagdating nila doon sa patient, meron na silang confidence.
So yung feedback, no? Feedback. Nikki, ikaw, ano tingin mo?
I think I can answer that through our surveys when we had the telemedicine service, which was organized by our clerks 2 years ago. So they organized the system by which the faculty will be the attending physician for those who would access the telemedicine. And it resulted in a direct communication and interaction between students and consultants. That was it. That was the biggest thing that came out of all of this simulation, telemedicine, because most of our students have no interaction with consultants. They had to be in direct contact with them instead of just meeting residents in training at Quirino.
That's true, no?
So,
Pagka consultant
nangyayari
yung
tuloy,
mo, iba. Oo. Nikki, na-mute ka. Ano ba yan? Na-mute o nawala?
text kami ng mga estudyante. Receive text messages. Hear me now?
Yes,
Yeah,
you're
good.
okay,
We
Dr.
hear
So
Lee.
that's
you.
it.
Good.
The interaction to the we message our students, they message us back. We receive calls, texts, whatever, complaints directly from our students. And I think this is a good thing as far as mentoring is concerned. And I think it will encourage many of them to pursue this further.
So it's really still yung human interaction, no, with the consultants. Sige, Ma'am, Professor Erlyn.
Nasabi na po ni Dr. Brion at saka ni Dr. Atienza, yung siguro ang dadagdag ko lang yung consistency ng socialization. You can start with role playing and then it will be reinforced by continuous simulation. Tingnan natin yung taxonomy ng skills acquisition. Merong after perception, may set. That's the time that you can sense if the student is ready to perform the clinical procedure in a simulator. Ibig sabihin, wala na siyang jitters, wala na siyang anxiety na parang nagme-memorya ng procedure, ano yung number 1, ano yung number 2, mga ganun. So, if the student shows already some degree of confidence at that level, pwede na siya humawak ng models. At magkakakumpiyansa na yun, automatic. Akala lang nila hindi nila nakukuha, pero yun nga, with the presence of the preceptor or the supervisor at saka yung sarili niya, nakokontrol na niya yung sarili niya, controlling the faculties. Nice. An indication na may confidence na. Thank you.
Stella, ikaw, confidence.
For the resident trainee to gain confidence, no? First, there should be knowledge. Ano talaga yung objective of this procedure, and then repetition, no, kasi palagi niyang gagawin, and then yung confidence talagang parang it comes naturally na hindi mo na siya iniisip na mahirap, parang naisip na ganito ang dapat kong gawin. So even before you do an OR, nasa isip mo na yung steps, nire-review mo na yan, kahit consultant ka na, it doesn't change, no, kasi the things that you should do, ano na yan, plansyado na yan sa isip mo. Yun lang ang masasabi ko.
Yeah, nice. Very nice. Okay, Raymond, we'll take just one question, then we'll have to go to the answers to our fun quiz. Sige,
Okay,
Raymond.
then I will choose the most upvoted question coming in from Nathaniel Young. Doesn't competency-based learning conflict with the time-bound nature of most residency training programs? If there is a decrease
can I answer that one?
Sige, ma'am, go ahead.
Kasi I understand his question. No? So, because of the, di ba, time-bound na. So, yung first year, January to December, ang problema nga, we had so little patients. So, what happened with us, nagkaroon ng extension. In-extend sila until all the requirements were fulfilled. Ganun ang nangyari. So, it's not, hindi na siya masasabing time-bound kasi we cannot let them go without fulfilling the requirements. It's not done. We have to follow the OB guidelines. So that's the way it happened. So we requested for 6-month extension, but in 3 months they were able to finish all the required procedures. So they were able to graduate. So it's naging 4 years and 3 months ang residency training namin. Let's hear from Techi. Tech, what happened in PLM? Ganon din ba?
Doon sa residency training program, oo, no? But maybe I'd like to speak in as part of PBOG, na Philippine Board, no. Actually, we have been talking about that already, no. And I think the talks will continue as we move towards our strategic planning, no. Kasi nga sa ngayon, talagang mahirap na gawing strict na time bound. There should be a means by which we can actually evaluate the competency, no. Actually ngayon di na, pero pareho lang siguro yun, magkaiba lang ng terms, no. Ma'am Erlyn, di ba, yung competency based at saka outcome based, no. Binago lang ng konti pero actually it's the same. So we're moving towards that in the board, no. Paano ba natin sisiguraduhin na the outcome has been accomplished, maybe not in terms of time but in terms of skill? But that's easier said than done, and it will probably take a lot of work, a lot of discussions before we can move towards that. But that is the ideal, no? Kasi merong mga residente na 4 lang ang nagawa, sobrang galing na. Meron naman 20 na ang nagagawa, gusto mo pa rin pukpukin, no? Dahil hindi pa rin kompleto at baka makapatay pa, no? So that is something that it's still hard, no, to really ensure that that will not happen.
Galing. Nice. Okay, we have to go to answering the fun quiz, Raymond.
Can we have it on the screen and the one also in Slido? Okay, Slido po. Thank you. So the 2 questions that we have, we'll post this to our main speaker, Dr. Jose. What are the advantages of undergoing simulation ahead of actual procedures? What's the correct answer, ma'am?
The correct answer is all of the above.
All of the above. Okay, 89% in the Zoom answered this one. And in Slido po, 100% naman. So nakakatuwa. Although 9 people lang po talaga nakasagot po, ang sumagot ng ating in Slido. For question number 2, what should teachers do to maximize the benefits of simulation?
Ako pa rin.
Yes, ma'am. Yes, ma'am.
The answer kasi yung mastery of techniques, training on how to use simulation for teaching, attention to details, and supervision. So they were all mentioned, no, in our lecture. All of the above din yung answer.
Okay. 79% naman po sa Zoom and 78% answered that in Slido. So thank you so much, Dr. Stella. But before we move on sa ating final messages from our excellent panel of speakers, we'd like everyone to answer ito pong evaluation poll po natin. We will not be sending out any evaluation polls na hiwalay po, no? And this is something that we oftentimes, can we have it on the screen? Thank you. I'm not seeing po kasi the evaluation poll. But just wanted to mention that we do not send out a separate evaluation poll. Ito na po iyon. So hopefully that's something that everyone who are, especially those in the Zoom, will be able to answer. We really appreciate your feedback for all 122 webinars and for today as well. There are 5 questions and it's a 4-point Likert scale. First question, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing our panel discussion until the end of the webinar as we move on to asking each of our speakers 1-minute messages to our audience. Dr. Susie?
Okay, let's start with Dr. Techi of PLM.
Thank you very much again for this chance to be with you in this forum. Siguro ang message, teaching and learning is the same, pandemic or non-pandemic, but kailangan maalala natin na ang sentro ng ating teaching and learning is yung estudyante natin, yung trainee natin, no? At ang end in mind, ang goal parate sa atin dahil medical education and training, ang goal natin is a good healthcare outcome for our patients. So eventually, tinatanong kanina, paano ba magkakaroon ng confidence? Yun ang confidence na sigurado ka na pwede kang magsilbi sa isang pasyente at hindi siya mamamatay at siya ay magiging mabuti, no? Magiging maayos. So as teachers, I think doon ang ating focus. Thank you very much.
Thank you very much, Tech. Let's go to Nikki. Doc Nikki of San Beda.
Well, my final message is not just for students, but for faculty as well. I believe that what we have learned the last 2.5 years, it's something that we will have to continue and probably pass on to the next generation of faculty who will come after us. So everything, all of these things that we have learned, even just logging into Zoom, etong poll, and then simulation, everything is good. Everything is for the good of education. And it's both for the students and for the faculty as well. Thank you.
Thank you very much. That's Dr. Nikki Atienza, the Dean of San Beda College of Medicine. Okay. Ma'am Erlyn, former Dean of the National Teacher Training
Okay naman si Dr. Susie, naki-ma'am na rin.
Sige na.
Thank you very much for this opportunity to react to Dr. Stella Jose. Si Stella Jose ay isa naming estudyante and we consider her a hero for all the things that she's doing, not only for UP Manila and PGH, but also for health professions education. Nasabi na ng ating mga kasamahan na patuloy ang buhay, may pandemic o wala, pero salamat din sa TVUP for creating yourself into a program that goes beyond the COVID-19 pandemic. Salamat po.
Thank you very much. That's Dr. Erlyn, Professor Erlyn. Okay, our main speaker, Stella, take the floor.
First of all, I'd like to thank the TVUP for giving me this chance to give this lecture. My message is really, as physicians, we have to have that end goal in mind. You want to be a good obstetrician gynecologist, you have to train for it. Then you have to teach that to others. If the learning should not stop with you. When you teach others, for example, you taught 12 to 12 residents. Those 12 residents will go to their provinces, to their hometowns, and they will teach others. So it is like a multiplier effect. So simulation is just one step to that. You have to be good at what you do. You have to be sure of your decisions. There's a lot of ethics in it. And, the practice of medicine should be really ethical. You do not do something that you're not sure of, and you do not operate on a patient who should not be operated. That's reality. Some would do ORs for very small myomas na can be medically treated. So let's not go that way. We owe it to our patients to give the best of what we know. Yun lang. Thank you.
Thank you very much, Dr. Stella. It was very inspirational, and thank you to all of the speakers today for your time. We know that you spend time preparing, thinking, and just giving up whatever this 2 or 3 hours is of your time. Maraming salamat. For closing remarks, we're going to have the Chancellor of UP Manila, Dr. Padilla. Menchit, take the floor, please.
Magandang hapon po sa inyong lahat. So today's webinar is entitled, How Effective is Simulation in OB-GYN? Our main speaker is Dr. Stella Jose, and allow me to share the highlights of her talk. She started with the domains of learning at the PGH Department of Obstetrics and Gynecology. First is the cognitive knowledge base, presented through summary rounds, staff conferences, and journal clubs. Second will be the affective domain, emotion-based. And it's interesting to hear that they teach compassion, honesty, diligence, humility, and altruism through group mentoring and wellness programs. And the third will be the psychomotor domain action-based, the ability physically to manipulate a hand. She presented the hierarchy of the psychomotor domain: perception, guided response, mechanism, complex overt response, adaptation, and origination. And it was interesting to see the scores of the department in the various domains for the previous years. It is important to monitor performance. Dr. Stella presented expected skills to be developed in the various levels of training. And I assume it's the same with the other hospitals present today. And she emphasized the role of supervision of the consultant and the senior resident. Now, with COVID as a COVID referrals, with PGH as a COVID referral center, only COVID positive patients were accepted and or complicated OB-GYN cases. And this affected the numerical requirements for skills for residency training required by the Philippine Obstetrics and Gynecological Society. And these challenges highlighted the value of simulation, defined as structured learning, giving a feeling of security to students and resident trainees as they practice on non-human cases. Now, I will encourage you to watch the replay to review the various videos that she shared as they demonstrated the importance of simulation in the role of skills acquisition. Our first reactor is Professor Erlyn A. And allow me to just mention the 4 points. First, true education is timelessness. It is something that endures through changing conditions, such as the pressure of the COVID pandemic. Second, only the teaching learning platform change. And as the training continues or continued, as in our case, the same program outcomes remained with the same ends in mind. And she has a reminder to all the faculty in the audience to engage in knowledge translation activities and to reinvent knowledge. The third point is an appreciation of the role of simulation in preparing training for the surprises. And fourth will be the value of supervision during the simulation and the actual cases. Our second reactor is Dean Atienza of Beda University. He presented their steps in preparing the students for training and seeing patients under COVID. And to show the innovativeness of the students, they bought suture sets from Shopee, indeed a very affordable way of learning skills. And Beda bought simulators, which were used by the faculty for various procedures in obstetrics and gynecology, internal examinations, labor, vaginal delivery, and so on. And the good news for the students and the future students of Beda University, they are planning a simulation floor in an upcoming building. Our third and last reactor is former Dean Brion. And she started by saying that simulation for teaching clinical skills involve the control of training and exam process, referring to standardization of training using performance checklists, a test blueprint, and training logistics. Second will be the trainees learn from their mistakes in a safe environment without hurting any patients. And third will be to be able to practice skills as many times as they need before they see a patient. PLN also demonstrated their resilience during the time of COVID. And really, I must appreciate their improvised materials, the sponges, the cartons that they sent to the students with instructions, and with students sending a return demo video so that the faculty could evaluate. Dean Brion aptly ended their talk by saying, "If you are determined to learn, no one can stop you." Now, in closing, let me end with the take-home lessons from Professor Erlyn A. Open quote. Curriculum starts as a plan. It only becomes reality when teachers implement it with real students in real classrooms. Careful planning and development are obviously important, but they count for nothing unless teachers are aware of the product and they have the skills to implement the curriculum in their classrooms, close quote. Indeed, COVID was a challenge, but it also showed the resilience of our education system. So allow me to congratulate the Philippine General Hospital, Beda University, and Pamantasan ng Lungsod ng Maynila. Magandang hapon po sa inyong lahat.
Oh, thank you very much. Our very own Chancellor of Manila, Padilla. Well said. Wonderful synthesis. And we have to bring our webinar to an end, to a close now. Next week, don't miss it. Okay, eto na. If you look at the news internationally, ang kumakalat na subvariant of Omicron now is XBB in Europe. In Asia and in the United States, it's BQ1 and BQ1.1. So we are going to talk about these new variants. We're going back to COVID in that discussion. Lots of concerns about how we're not sure. I don't know. No, let's listen to our experts that some of the previous vaccinations are not that good against these new subvariants. So please invite others to join us as we talk about this next week. The new subvariants, XBB, BQ1, and BQ1.1. Raymond, over to you.
Thank you, Dr. Susie, and thank you to Chancellor Padilla. Also, happy Foundation Week po, celebrating po ang University of Philippines Manila for this week. So maraming salamat po. You will also see in front of your screen that at least 92% of our attendees, at least those who participated dito po sa ating panel discussion poll, evaluation poll, said that they strongly agree with all of the questions and statements that are included here. So maraming salamat po, especially to all those who participated in our evaluation poll. We'd also like to take this opportunity to thank and show our appreciation to all of our panelists from Philippine General Hospital, from the National Teacher Training Center for the Health Professions in UP Manila, from Beda University College of Medicine, and from the Pamantasan Lungsod ng Maynila College of Public Health. Also thanking the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content each and every week. And then finally, we have all of the webinars archived in the youtube.com/TVUPPH. 122 episodes po siya ngayon, and will be 123 right after today's webinar. So we hope you'll take the time to watch our previous episodes, and we'll be able to gain maybe a few more kung mayroon po kayo nakaligtaan o may na-miss po kayo na episode sa ating webinar series. So this formally brings to a close our webinar for this week. Magkita-kita po tayo again next Friday po from 12 noon to 2 p.m. It's a date.
Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online.